Hey guys, Dr. Maurer here with Family Back and Neck Care Center. It's been a while since I've done one of these videos, so I'm going to see if I kind of remember what we're supposed to do here. Bear with me. Today we're going to be talking about disc issues because it's one of the most common problems that we see in our office, probably top 5. People come in all the time and they say, I've slipped a disc, but the truth is a disc doesn't actually slip, okay? The intervertebral disc is a common culprit for a lot of spinal related health problems, but its function is pretty misunderstood. The disc is a small cartilage pad that's situated between the spinal bones. It's got a soft jelly-like structure in the center that's kind of contained by these layers of fibrous connective tissue on the outside. Each disc in the spine serves as a connector piece between the bones and a spacer and a shock absorber for the spine. And when it's healthy, it allows for normal turning, normal bending. But when that disc bulges, herniates, ruptures, it leads to a lot of other problems that we're going to talk about. So most people don't know this, but the spinal discs are the pads between the joints of the spine. They have a very poor blood supply, and they depend a lot on the circulation of joint fluids to bring nutrients into the disc and get rid of waste from that disc. When the spinal joint loses its normal motion and pumping action to get this blood supply and circulation, when that's impaired, the health of the disc begins to deteriorate, and it's very similar to a wet sponge where the disc, if it's healthy, is flexible, where a dry sponge is hard and it can crack, and that kind of process takes place. Because of the way these discs are attached to the vertebra above and below, a disc cannot actually slip. Now, trauma and injury can cause a disc to bulge, herniate, or at worst rupture, and this can be very, very painful. But it can also put pressure on the spinal cord, put pressure on the spinal nerve roots, and interfere with the function. So what we do as chiropractors, and kind of the chiropractic approach to these problems, is to help restore the normal motion and position to the spinal joints that are not functioning well. Besides reducing the disc bulge, better spinal function can actually help decrease the inflammation to slow the process, to help the slow process of healing the soft tissues around that structure. So that's kind of the chiropractic way that we deal with it. Hopefully this gives you a little bit of an insight on how we kind of deal with disc issues, what to look for when looking at disc issues, the different types of disc issues and how they actually work. Obviously, comment down below on this video if you have any questions. Again, disc issues are probably top 5 conditions we see here in the office. They're very, very popular. They're easy to treat in some cases, difficult to treat in some cases, and it really just needs to be evaluated in order to determine, what needs to be done in order to get you back to 100%. So comment down below if you have any questions, like this video, follow our page over at Family Back and Neck Care Center, and we'll be tuning in again later in the week with a different health-related topic. If there's something you want me to cover in one of these videos, just comment down below with a health concern, question, comment, and I'll pop on and give you guys a quick tip, a quick answer to any of those questions. So we'll plan on talking to you later in the week. Everybody, I hope you survive the storm outside and you all are safe on this lovely Monday morning in the Ozarks. So everybody have a great Monday, and we'll tune back in later in the week.